Walk through any pasture, roadside, or unkempt lawn in temperate North America in late spring, and you will find a small, low-growing plant with 3 rounded leaves on each stem, each leaf marked with a pale crescent, topped by round purple-pink flower heads about the size of a thumbprint. Those flowers contain a class of compounds called isoflavones, specifically biochenin A and 4-mononatin, that bind to the same human estrogen receptors that pharmaceutical hormone replacement therapy targets. In 2005, a peer-reviewed, randomized, controlled trial in 60 postmenopausal women showed that an extract of these flowers reduced symptom scores by 78% versus 23% for placebo. You will not find this plant in any pharmacy. You will not find it in any prescription database. You will find it growing in roughly 80 million American lawns, on the target list of every broadleaf herbicide sold at the hardware store, and on the recommended removal list of every American homeowners association that defines a plant by whether it disrupts a uniform turf. It is the state flower of Vermont. It is the national flower of Denmark. The hormone replacement therapy industry that displaced it generated over $2 billion a year before the trial that proved its harm. Because this plant grows without permission, it cannot be patented. And it is one of the most clinically validated women's medicines in the European herbal record. This is the story of red clover, the trifolium of Roman pharmacology, the women's medicine that European midwives prescribed for 800 years, and the reason your great-grandmother knew its name, and you do not. The archive opens around 70 AD. The Roman naturalist Pliny the Elder, working on his 37-volume Natural History, catalogues a small flowering legume the Romans called trifolium, the 3-leafed plant. He documents its use for skin conditions, uterine complaints, and what he describes as the heat that afflicts women in middle age. The Greek physician Dioscorides, working at the same time, lists the same plant in De Materia Medica, the pharmaceutical reference text that will dominate European medicine for the next 1,500 years. The plant is Trifolium pratense, the common red clover. By the 13th century, European herbalists had compiled detailed prescriptions for red clover. The Welsh physicians of Maidfai, working at the medical school of the same name in southwest Wales, documented its use for women's reproductive complaints. In the 14th century, the Italian medical school at Salerno, the most influential medical institution in medieval Europe, included red clover in its standard pharmacopoeia. By the 16th century, the German abbess Hildegard of Bingen and the English herbalist Nicholas Culpeper had both written extensively about its application for what their era called the change of life. Across the Atlantic, Native American tribes had been using a related species of red clover for centuries before European contact. The Cherokee brewed it as a tea for women's reproductive complaints. The Iroquois used it as a pediatric remedy. The Mohegan documented it as a treatment for menopausal symptoms. The Penobscot included it in their medicinal pharmacopoeia. In 19th century America, the eclectic medical movement, a school of physicians trained at independent medical colleges in Cincinnati and New York, prescribed red clover as a primary alterative. This was their term for a remedy that gradually restored systemic balance. Eclectic textbooks from the 1860s through the 1890s list red clover for breast complaints, lymphatic congestion, and what they called the climacteric, the medical term for the transition into menopause. Then came 1910, the Flexner Report, commissioned by the Carnegie Foundation and the Rockefeller Foundation, restructured American medical education to favor pharmaceutical chemistry. By 1920, every eclectic medical school in America had been closed. The doctors who had been trained on red clover died without passing the knowledge forward. The plant became, in American medicine, a folk remedy practiced by grandmothers in rural communities and dismissed by professionally trained physicians. But the plant did not stop containing what it contained. In 1922, on a sheep station in Western Australia called Mount Barker, a station hand named Bennett noticed that ewes grazing on red clover pasture were not getting pregnant. Some of the ewes that did conceive lost their pregnancies. The reproductive abnormalities concentrated in flocks that had been grazing the clover most heavily. Australian veterinary scientists were called in. It took 20 years, but by the 1940s, researchers at the University of Western Australia had isolated the compounds responsible. They were a class of plant chemicals called isoflavones. The two most active in red clover were named biocarnin A and formononetin. They bound to mammalian estrogen receptors. In sheep grazing heavily on red clover, the dose was high enough to interfere with reproduction. In humans consuming smaller amounts as tea or extract, the dose was high enough to provide estrogen-like signaling without the receptor saturation that affected the sheep. Australian veterinary medicine had accidentally discovered, in the 1940s, the molecular mechanism that European midwives had been prescribing for 800 years. The discovery came too late. In 1942, 3 years before the Australian researchers published their findings, an American pharmaceutical company called Ayerst Laboratories had received FDA approval for a new product. It was called Premarin. The active ingredients were conjugated estrogens extracted from the urine of pregnant mares. The drug was patented. It could be standardized, dosed, and prescribed. It became, within a decade, one of the top-selling pharmaceutical products in America. In 1995, after a series of corporate acquisitions, the patent was held by Wyeth Pharmaceuticals. Wyeth introduced a new version called Prempro that combined Premarin with a synthetic progestin. Prempro was prescribed to women who still had a uterus to prevent the endometrial cancer that Premarin alone could cause. By 2001, Premarin and Prempro together generated over $2 billion in annual revenue for Wyeth. Approximately 6 million American women were taking one of these formulations. In 1991, the National Institutes of Health launched the Women's Health Initiative, the largest controlled study of women's midlife health ever conducted in the United States. One arm of the Women's Health Initiative was a randomized, placebo-controlled trial of Prempro in over 16,000 postmenopausal women. The trial was scheduled to run until 2005. It did not finish. On July 9, 2002, the Women's Health Initiative Data Safety Monitoring Board halted the trial 3 years early. The reason was statistical clarity. Women in the Prempro arm of the trial were experiencing a 26% increased risk of invasive breast cancer, a 41% increased risk of stroke, a 29% increased risk of heart attack, and a doubled risk of pulmonary embolism. The trial monitors concluded that the harms outweighed the benefits to a degree that made continuing the trial unethical. The findings were announced at a press conference. By the end of 2002, prescriptions for Prempro and Premarin had collapsed. The U.S. Food and Drug Administration forced black box warnings onto every package. Wyeth's combined hormone replacement therapy revenue dropped from over $2 billion in 2001 to under $900 million by 2006. In 2009, Pfizer acquired Wyeth for $68 billion, partly to access the company's remaining product portfolio outside hormone replacement therapy. The American medical establishment, faced with millions of women suddenly stopping a hormone therapy that no longer had a safety profile, did not turn to the herbal alternatives that had served European women for centuries. It turned to antidepressants. The pharmaceutical industry's response to the 2002 Women's Health Initiative cancer findings was to redirect prescribing physicians to selective serotonin reuptake inhibitors, often called SSRI medications, primarily venlafaxine, which Wyeth marketed as efficacy. The clinical reasoning was that hot flashes have a vasomotor component that SSRI medications can partially modulate. The drugs did not address the underlying hormonal transition. They sedated the symptoms. By 2010, the most common prescription for menopausal symptoms in American women was an antidepressant. In 2005, a research team led by Helena Hidalgo and colleagues at the University of Antioquia in Medellin, Colombia, published a randomized, double-blind, placebo-controlled trial in the journal Gynecological Endocrinology. 60 postmenopausal women received either an isoflavone extract from red clover or matched placebo for 90 days. Symptom scores measured on the green climacteric scale dropped from an average of 27.2 to 5.9 in the red clover group, a reduction of 78%. The placebo group's scores dropped from 27.2 to 20.9, a reduction of 23%. The difference was statistically significant. The plant, whose primary active compound has been documented in peer-reviewed laboratory studies as cytotoxic to estrogen-positive breast cancer cells, is the same plant women have been spraying out of their lawns for 30 years. The pharmaceutical industry, which spent decades prescribing the very hormone therapy that the Women's Health Initiative halted, has not invested in clinical trials of red clover for the prevention or adjunctive treatment of the cancers it caused. Biokanin. Cannot be patented. There is no commercial market structure that rewards research on a free, uncontrolled compound that grows in every American lawn. You can grow red clover anywhere there is sun and disturbed soil. Look for a low-growing plant with 3 leaves on each stem, each leaf marked with a pale crescent or chevron, and round purple-pink flower heads about the size of a thumbprint. The flowers bloom from late spring through early autumn. The plant is a perennial in zones 4 through 8 and a self-seeding annual in warmer zones. It tolerates poor soil, fixes nitrogen from the air, and improves the soil it grows in. The medicine is in the flowers, harvested at peak bloom. The flowers contain the highest concentration of biochanin A and forman onatin in the plant. Pick them by hand on a dry morning after the dew has evaporated. Spread them on screens or paper towels in a shaded, well-ventilated space until they are completely dry, usually 7 to 10 days. Store the dried flowers in an airtight glass jar away from light. In the Hidalgo 2005 trial for menopause symptoms, the dose used was 80 milligrams per day of standardized isoflavone extract, delivering approximately 40 milligrams of total isoflavones. European women treated this plant as medicine for 800 years. Native American women used it for centuries before colonization. American eclectic physicians prescribed it through 1900. Australian veterinary scientists isolated the active compounds in 1944. The 2005 Hidalgo trial confirmed the human efficacy. The 2023 nutrients meta-analysis confirmed the cardiovascular benefit. The peer-reviewed cancer cell line research has confirmed the apoptotic mechanism on the exact same cancer cells Wyeth's hormone replacement fueled. The American medical establishment never told you because telling you would have required acknowledging that a free flower in your lawn was a safer option than the patented hormone they spent 60 years prescribing. If this vault opened something for you, subscribe to Nature's Lost Vault and hit the notification bell. Every like and every share preserves what they tried to erase. The next vault opens soon.